Adriane.
Hi, Marina. How you doing?
Well, actually, kind of shitty, to be honest.
Why?
Well, I had a phone call today and from the nurse, and they basically are telling me that I need to go in for the dreaded colonoscopy.
Okay. That's good. You should get it screened. I mean, when was the last time you had a screening?
I've never had one, so I'm really, really scared and really, nervous about the whole thing. I've heard horror stories.
No. Actually, most people, pretty well all people after 50 should get a routine colonoscopy. Actually, it's recommended you get one done every 10 years, but every 5 if there's issue. And of course, right away if there's a problem. Now, to do this, they do things like stool tests, and you should, after 50, get it done every 2 years. That'll show you if there's blood in the stool or there's an issue, and that will prompt your doctor to call you and order a colonoscopy. Is that what happened?
Well, that's exactly what happened. Actually, I had heard that I should be getting screened, and that was a number of years back. But when I talked to my doctor, he said no, they need to find blood or something abnormal in your stool. So when I had my blood work done, my regular blood work, that came up, and so they did find blood. And now I am off and going, and of course I'm nervous about the whole procedure. Probably more so than I'm not so worried about the results because frankly I feel pretty good. I haven't had any symptoms that I found really alarming to speak of, but it's just the whole procedure. Now, you've had one, right?
I had a routine one, and there's like nothing to worry about. You do like an enema and a cleansing diet for a couple of days because they need your colon to be totally clean. And then they give you a mild sedative. They put an IV in. I remember going into the operating room and they put me on a screen. They told me what they're doing. They asked me to count down from 10. I got to like 7. I was out and I woke up in a recovery room. It was very simple. There's absolutely no problems, nothing afterwards. You can just get up and walk. But because of sedation, you do need a ride home.
Well, I've heard that the actual getting ready for the colonoscopy is worse than the actual colonoscopy. Is that correct?
Well, you kind of have to clean your colon, right? They don't want to go in there with stuff in there. They're trying to look at the membrane and what's inside. You can't have things in it. You need an empty chamber, so to speak, right? Nothing in there.
Hey, listen, that chamber has been filled for many years. There is nothing empty in there. It is full to the brim.
But it needs to be emptied. So it might take, a week instead of 3 days in your case. So, yeah, but Marina, don't worry about it. It's a very simple procedure. And you know what? Blood in the stool is one of the first symptoms that there's something going on. So when they go in there and they define polyps or something, they deal with it right away. If they have another concern, they'll take a biopsy. You won't know because you're asleep or you're heavily sedated. And biopsy will tell them whether or not it's cancer. Now, I have to point that out, and this is really important. Did you know that 90% of all colon cancer is treatable?
No, I didn't.
Yeah, so this is why it's so important to get those stool tests done, and that'll show if there's an issue, and then you'll get a colonoscopy, which is so simple, such a simple procedure. So no worries. And there's something else I want to point out, Marina. Did you know that colorectal cancer is now showing up among younger people? So maybe we need to push back that screening to a younger. Get your stool test done even earlier. If there's any symptoms or any concerns, go talk to your doctor.
So what would some of the symptoms be? I mean, blood in the stool is an obvious one, but you want to know something, Adrian? I didn't know that there was any blood in my stool. It's not like I noticed it. I would have been running to the hospital right away if I did.
Right.
It was minute. So, are there any other symptoms to watch out for?
Maybe irregular bowel movements would be another one. Yeah, cramping, feeling full, any stool related issues, but get that stool test. It's very simple. All it is that you just take a little sample of your stool, you take it to a lab, and voila.
Right.
you'll get the results very soon. And
Right.
it's such a simple test, and it's so preventable for anybody to do it, even the young people. Just get
Well,
it done.
I gotta tell you something though, you said it's such a simple test to do, and, you go to the lab, and now what they do is they send you home with the little vial, and you take it home, and well, you know what? I had to do it, like, 3 times before I managed to successfully get one, because the first time I dropped the whole thing in the toilet, ruined the test. The second time, I thought I had it, and if you get it wet, if a bit of water lands on it, or if one drop of pee lands on that poop, void, null. And I can tell you, if you've ever had to poop and not have any pee come out at the same time, because maybe it's easier for men, but not so easy for older women. It was a bit of a challenge. That's all I have to say, but worth it.
Of course, it's a bit of a stinky, proposition, but hey, what the heck? The results are better.
Right. So I'm not feeling so crappy anymore. Thanks for lightening my load. I'm going to try and look at the bright side. Not only will I have clean and clear intestines, I'll probably lose like 5, 6 pounds, and I'm going to take that as a win.
That is definitely a win, and so is getting this test done. I wish you the best of luck, and we'll know the results soon.
Well, I guess we'll know the results as soon as my specialist calls and books it. So will hopefully be good news.
Yes, good news, 5 pounds lighter and a clean colon.
Right, because I have heard that not everybody's as smooth sailing, and there is a little bit of a risk factor, but it from what you're saying outweigh any risk in order to get screened because if it's a cancer that's preventable, we definitely want to do that because that's part of aging well is keeping ahead of the curve when it comes to your health.
Exactly. And if you have a story you'd like to share with us about your procedure or your experience, please leave it in the comments below.